Okay, let's start with the respiratory case scenario. Respiratory blues. Sebastien is a 13-year-old with cystic fibrosis. He lives with his mom and sister who do not have cystic fibrosis. Sebastien is in the 7th grade and he enjoys riding his bicycle. He usually spends a few days in the University Medical Center each year for intensive therapy sessions to clear his lungs. It actually takes a lot of time each day to manage cystic fibrosis. All of Sebastian's care must be scheduled around school and recreation. In most cases, the treatments cut into his recreational time. However, Sebastien has learned to manage many aspects of his care, relieving his mom of many tasks. Sebastien sets up his nebulizer and correctly measures the amount of DNAs to use. Think, what's DNAs? After the nebulizer treatment, he uses an oscillating vest for airway clearance for about 20 minutes. Coughing up sputum during and after the treatment is very tiring. Sebastien needs extra calories to grow and to meet metabolic demands. His mother works hard to prepare and provide the extra calories he needs throughout the day, and he takes pancreatic enzymes to help him digest food. Because Sebastien sometimes has difficulty getting enough calories to support his growth, he has a G-tube for nighttime feedings. Why are children with CF at higher risk for respiratory infections? Think about this. What are signs of a respiratory infection and respiratory distress in kids and infants? Also, what nursing care should be provided to a child with respiratory condition? Think about all these questions. Great, now that we've gone through the clinical case scenario, you can watch the video on a pediatric respiratory assessment. Next, you can actually go to a clip of me discussing the short summary of what I think is important in the PEDS assessment. I've also provided you with a high-yield reference table as well as visual mnemonic for respiratory distress. I hope you find these pretty useful. You can also click on the link to download them to your computer. Now, as you go through the table, think of the physiological basis behind each clinical finding. All right, look forward to discussing in lab.